Welcome, Dr. Hyman.
Oh, great to be here and lovely to be with you and all your lovely guests and listeners out there. I'm excited to talk to you about what's going on in the world of health and medicine and the future.
Likewise, we were just talking before we started recording about our podcasts and how long we've been in the game. And you were one of the top guests that I've wanted to have on for 5 years.
Amazing.
So it's so nice that we're finally sitting here, and we're going to be getting into all of the health topics and the science and all of that. But I want to rewind to how you started, because you were doing functional medicine before it was mainstream and what it is today. And it's always interesting to me when I talk to doctors who started on the traditional Western medicine path and then have kind of changed their trajectory into this more integrative practice. And it always goes back to personal experience where they got sick and they couldn't get any answers, no healing, and that changed their trajectory. And that's what happened to you, right?
Yeah, for sure. I actually, always was a little bit of a weirdo. I mean, I majored in Buddhism in college. I studied ancient healing systems from around the world. I studied, shamanic healing, Tibetan medicine, Chinese medicine, just from an academic perspective. I was very interested in just the nature of healing. And I was a yoga teacher before I went to medical school. It was embarrassed to say, it was like 41 years ago, I was a yoga teacher. They didn't have yoga mats back then. They didn't have Lululemon. You were just messing had a towel and some sweatpants and t-shirt. And I went to medical school, and I decided to sort of go the traditional route to really be able to do whatever I wanted to do. And I got pretty good at it, and I was practicing as a small town family doctor, and I was doing everything, ER, delivering babies, working 80 hours a week, and I really enjoyed it. And I realized, I was really kind of brainwashed. I had kind of already studied nutrition. I was already focused on lifestyle and health. I already was doing all that myself, but I was still just giving people drugs to suppress symptoms. And I did that for a while. Then I went to China and worked as sort of developing these health clinics for expatriates, because, back in the 90s, there was a lot of expatriates, but they didn't want to go to a Chinese hospital or clinic. And in China, in Beijing, it was really polluted. And I got exposed to a lot of the pollution from the coal burning, which is full of mercury and lead and other toxic chemicals, and cleaned my air filter out every day. Got really exposed to concentrated amounts of this, which was super stupid when I look back at it. Came back, worked in the air for years, and then I got really sick. But it's sort of in that interim, I decided I wanted to go back and do something more around wellness and my original sort of interests. And I got a job at Canyon Ranch as a medical director. And after I got that job, it's when I got sick.
I love Canyon Ranch. Arizona?
Yeah, it was in Lenox, Massachusetts.
Oh,
and
okay.
I went down. Like I had chronic fatigue syndrome. I went from riding my bike 100 miles a day to where I couldn't basically walk up the stairs. I had, incredible cognitive function. Before I could see 30 patients in a day, never take a note, remember everybody case and what they said and what to do and what I said, and dictated at the end of the day with no problem, to being not able to even remember where I was at the end of a sentence from where I started. And I remember having the experience of reading my kids a book at night, and I would read it aloud, but I couldn't understand it. Like my brain was really broken. I had severe muscle pain. I had developed autoimmune symptoms. I had terrible GI issues. I had, diarrhea, and we call it SIBO now. We didn't call it that then, but it was bacterial overgrowth in the gut. And I was just a wreck. And I was sort of desperate to find out what was going on. I went to doctor after doctor, and Columbia, Harvard, everywhere, and everybody was like, oh, you're depressed, or you're under stress, or I don't know, or this is benign, or, take some Xanax or whatever. I'm like, no. Something's going on. I'm a doctor. I'm having real symptoms. I mean, I would like have some certain foods and I would get rashes all over my face, or my tongue would swell and get sores on it. And I was like, there were really things going on. And then that's when I got introduced to Dr. Jeffrey Bland, who's a nutritional biochemist, studied with Linus Pauling. And he basically is a remarkable man who spent the last 50 years hoovering up scientific literature from a whole array of different disciplines and domains. So typically in medicine, it's like, you go to the gastroenterologist and you say, oh, I have this and that reflux, but I also have this rash. And they're like, oh, no, I don't want to deal with that. Go to the dermatologist or go to the rheumatologist. You say, my joints hurt. And they're like, well, but I also have these stomach issues. And they're like, oh, no, go to the GI guy. I don't deal with that. But they're all connected. The body's one connected system. So everything is connected. And Jeffrey Bland really helped connect the dots and see the future, which is systems medicine, is thinking of the body as one integrated system. And now everybody's sort of onto it. Everybody's talking about inflammation and mitochondria and the microbiome and, insulin resistance and all the things that we've been doing for 30 years are now like new, but they're not really new. Now we have way more data, way more research on it, but the early research was there. I mean, I wrote about a book 15 years ago called The Ultramind Solution, talking about, the role of mitochondria and toxins and the microbiome and mental health and neurodegenerative disease. And people thought I was crazy, but I'm like, no. One, first, I'm seeing this in my patients and it works when you try it. And two, there is some data and it's not like I'm making this stuff up. So it's been exciting to see. I mean, it's like, you work 30 years or something and then boom, it happens all at once. Mm-hmm. So it's sort of like, I'm kind of laughing to myself, like, it's not like really new, but the thinking is really important because most people out there are suffering who don't need to suffer. And they're suffering from conditions that most traditional medicine doesn't have really great solutions for. If you have an emergency, if you need a C-section, if you have a car accident, if you need back surgery, which I just had, great. But for most of the things that people have, it doesn't work. Whether it's migraines or irritable bowel or fatigue or sleep issues or hormonal issues for women like PMS or fibroids, endometriosis, infertility. I mean, you can do IVF and all that, but still, there's really not a lot of great approaches. And functional medicine and a systems approach, and I don't even like the term functional medicine. It's it's just medicine. It's just the nature of reality. So the way I think about it is, we know the laws of physics. Most people maybe can't, write them all down, but they know, oh, there's the law of gravity and the law of thermodynamics and so forth. And nobody sort of knows the laws of biology. If I said, what are the laws of biology? You're like, I don't know, because they haven't really been well described. So what functional medicine is, systems medicine, systems biology, is really an attempt to actually describe the laws of nature and apply those to human beings and use, for example, the gut microbiome as a key way to treat what's going on with your body. A lot of people don't know how to treat the gut. So I just talked to Marty Macker, who's a Johns Hopkins professor, wrote a book called Blind Spots. And, he was talking about one of the blind spots is like the microbiome. It's linked to Alzheimer's and autism and cancer and diabetes and heart disease and depression and autoimmune disease and asthma and fibromyalgia and chronic. I mean, it's just like everything. So, how do we not deal with that in medicine? Because it's not dealt with. We kind of know it now academically, but practically, what do you do? Well, that's what we do in functional medicine.
Yeah, it sounds like it's not new. And, to your point, you have been practicing this for decades, but now people are kind of waking up to it out of desperation. So you came to it out of desperation in your own experience.
I did.
And now as a society, we're all dealing with so many of these things. I mean, you're listing all of these things and I'm like, check, 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 check. I have all of that, and many people do. And I think that's why people listen to podcasts like this. People want answers. And I think it's so interesting that, you were talking about your experience in China and your lifestyle and being exposed to these environmental toxins and things, but then you didn't really get sick until a few years later where everything started going haywire. So is that typically what happens, where it's kind of a slow drip of exposure and then all of a sudden just bam?
When I take someone's medical history, I want to know about their grandparents' health. I want to know what their mother's pregnancy was like and what the mother did. I want to know what the birth was like. I want to know what she ate when she was pregnant. I want to know whether the baby was breastfed, when it had its first antibiotic, if there were any early signs of gut issues or colic. I mean, I go way back because when you look at the history, we call it the timeline, you can literally put together the pieces and see how people get to where they are. So things don't just start like that. So for example, autoimmune disease tends to sort of show up in the 30s and 40s, and it's usually the same story. Oh, I took a lot of antibiotics as a kid. I had gut issues, or I had acne and I took antibiotics, or, I had a lot of sinus and allergy issues and my gut wasn't good. And then I started developing this and that, and then it all turned into autoimmune disease. So I think, we have the story. It can tell us what's really going on. And these changes happen subtly over time. And for me, it's really the total load of stresses, right? So I managed to keep an equilibrium until I couldn't anymore, until the weight of everything that happened. And what triggered the final breakdown was I was in Maine and I had some bug. I don't know. I got in some, I don't know. I was in a camp and I don't know, the water or something, and my stomach just blew up. And I thought, I had some weird stomach bug. And then that was like the straw that broke the camel's back. That's a triggering event. And it's often like that. You kind of keep an equilibrium, then something happens and the bottom drops out.
That's interesting. I'm thinking about my own experience. Ashley knows, but that kind of happened to me last year where, I don't know, I had a lot of issues, hormonal, gut, things like that, and I would deal with it. And then last year I got super, super sick. Something happened. Actually, I got Botox, which I had been doing for a decade. And for whatever reason, I don't know if it was from the Botox itself or my immune system, but it was like your experience, it sounds like, when you got really sick, where it was the brain fog when you were talking about reading and not being able to connect.
Yeah.
That resonated with me. I couldn't articulate that to anybody. I had like chills. I mean, just debilitating symptoms. And I've talked to a lot of people on the podcast who have had similar experiences. I had somebody yesterday who got Lyme. She was going through a divorce. She was building a business. That happened. And then everything else fell apart.
Right. Exactly. And so the key is, how do you find out what's really going on with your body? And there's, you bring up a really good point, which is, the transition from wellness to illness doesn't just happen in one day. It's a slow progressive phenomena. And that's really, why I'm so excited about the company that I co-founded, Function Health, with a number of others, to help people get access to their own health data, to be able to identify the subtle changes that happen on the trajectory from wellness to illness and intervene early and ultimately even save lives. I mean, basically Function Health is a health platform that is a co-pilot for your health. It gives you access to your own data. I mean, right now everybody's wearing, Oura rings and Apple watches and biosensors and maybe the glucose monitor, and people are hungry to know what's going on with their bodies. But you can't go under the skin because you got to go through the doctor. You got to go through the insurance company. You got to get their approval. You got to know, get the test that you want. You can't even get them because the doctor goes, oh, you don't need that. You don't need that. Or the insurance will pay for this. So we co-founded a company called Function Health that allows people access to their own lab data. You just sign up online. It takes 5 minutes. You go into the lab near you. You'll find a lab. There's 2,000 draw stations around the country with Quest. You get your blood drawn and it gets analyzed and then uploaded into your dashboard, and you see your biological age, all your biomarkers. You can track them over time. And we do over 110 biomarkers for $4.99, which is about $15,000 worth of tests retail. And because we sort of negotiate, we can actually be able to get the prices down. So it's really affordable. And people get really, incredible insights about their health. And we found young people with cancer that they didn't know in their 40s and saved their lives. And, women with uterine cancer, men with prostate cancer, who, you would think it's a later stage thing. Or we're finding people, 35-year-old man had, fit guy, he's super healthy, eats great, he exercises, he looks great. And he has a family genetic history of really bad lipid issues. And so he had horrible lipid problems he didn't even know about, because most 35-year-old guys don't get their blood work done, And
is that like lipoprotein?
We looked at lipoprotein A, ApoB, lipoprotein fractionation, all these tests that you do not get when you go to your regular checkup. So if you go to your regular doctor checkup, they're not doing the most current tests to look, for example, at cardiovascular risk. So you get your regular cholesterol, you get your triglycerides, your HDL, LDL. That's almost meaningless today. We now know you have to look at the quality of the cholesterol, the size of the particles, the number of the particles, other biomarkers like ApoB and LPA, which are actually really important in looking at your risk. And he had all these problems. So then we sent him for a heart scan using AI, interpreted this heart scan, and found his heart was full of plaque. And he's 35 years old, heading for a heart attack. Wow. So we're able to help people identify things early in the transition and save lives. And not only that, but we're seeing things that are really fixable. That maybe, for example, 13% of the people we've tested, and we have over 60,000 members now. We have almost 300,000 people on the wait list. And by the way, if you're listening and you want to join, you can go to functionhealth.com and use the code BlondeFiles100 to skip that wait list. But if you get your labs done, you can see yourself where you're at with the trajectory of all these things. And 13% of the people in this cohort we've done so far have autoimmune thyroid issues. And often these are subtle things that people don't know. And the regular test that your doctor does will miss it. We do 5 tests to look at your thyroid. They only do 1.
Wow.
And so the 5 tests look at antibodies, they look at T3, T4, the other hormones that are really important. And we see people have issues, and you could be walking around saying, oh, I'm a little tired, I'm a little constipated, oh, my skin's a little dry, my hair seems to be falling out, my nails are brittle, I'm a little depressed, and the sex drive I did. It's like subtle things that you just think, oh, this is just me.
Like
but it's
non-specific.
not. And people, it's being mostly missed. We're seeing, for example, a large percent of patients having low ferritin, particularly women. And low ferritin is a iron storage test. And again, it's not a test you get when you go to your regular doctor. They just check like maybe 20 or 30 things. They don't really do a full analysis of nutrition and toxins and hormones and things that relate to your digestive tract and your cardiac risk and your metabolic health and blood sugar risk. And we look at all of that in great depth, and autoimmunity and inflammation and things that just are not checked. And so we see a significant number of women having low ferritin. Now, you might not have anemia, although some women do. But if you have low ferritin, which is the iron storage, it can make you tired. It can make your hair fall out. It can cause insomnia and have a lot of other symptoms that I'm not sleeping so good, or gee, my hair's a little, or I'm more tired. I don't know what's going on. Maybe I'm stressed. But it could be something as simple as you have a low ferritin.
Mm-hmm.
And we're seeing, we have mostly a forward population that we're testing, and we're seeing enormous problems. Like 89% have significant metabolic dysfunction with blood sugar regulation issues and abnormal lipids. 51% have high ApoB, which is probably the most important biomarker for looking at your heart risk, your cardiac risk. We see 46% have high inflammation. We have 30% have autoimmunity and don't even know it, a lot of them, with a positive ANA. We see, like I said, 13% with autoimmune thyroid disease. We see 67% with nutritional deficiencies. And these are not deficiencies that at the level that I would think are good. Like, in other words, your vitamin, like, what is the vitamin D level you need so you don't get rickets? Well, it's like 20. That's considered normal. Mm-hmm. Anything over 20 is fine. But what's the vitamin D level to achieve optimal health, to prevent infections and help prevent cancer? Like 50, right? So we're talking about levels that not that I would say the optimal levels, but at the reference range levels. So it's look, we're a sick population. 93% of us are metabolically healthy. 75% of us are overweight. 40+% are obese. 1 in 2 have prediabetes or type 2 diabetes. 93% have some kind of metabolic dysfunction, which means they have high blood sugar, high cholesterol, or high blood sugar, or have had a heart attack, stroke, or overweight or obese. And that's 93% of people fall into that group. So, people are like waiting around until something happens. And medicine is very reactive, not proactive. Mm-hmm. So, there's a really amazing scientist named Leroy Hood who really founded systems biology. He helped decode the human genome, was very involved in immunotherapy discoveries. He's won the Lasker Prize, one of the highest science prizes you can get in the world, like the Nobel Prize. And he talks about something called P4 medicine, which is preventive, it's predictive, so it tells you where you're going, it's personalized, and it's also participatory, meaning you have to participate. And so I think this is what, after COVID and everything, people are like, gee, man, I want to take more control of my health, And I think the goal for Function Health is for people to become the CEO of their own health, to actually own their data, to track their data over time. That, right now, if you go to this doctor here and you move a city, you go to that doctor, you go to this hospital or that lab, it's a mess. You can't get your data. You can't track it over time. You can't see the trends. You're probably not even testing the things that matter most in terms of your risk. And so that's really why we created Function Health. And it's amazing because we've done no real marketing, no advertising, just word of mouth. And I've done a few Instagram posts about it, but it's like people are hungry for, 300,000 people on the wait list with no marketing is crazy. Mm-hmm. Yeah. And the reason we have a wait list is we just are building this as we're flying it. So we're still in beta, but the experience is still profound. We're going to be creating what I call medical intelligence, which is kind of like AI, but MI, not the heart attack kind. But the idea is imagine having a place where you could inquire about your own data and get a personalized response that is informed by all the scientific literature in the world. Because if I spend 24/7 the rest of my life from the day I was born, I could never read all the scientific papers ever published. but AI can do it in about 5 minutes, right? And then it can synthesize it and stratify it based on the quality of the evidence. We're bringing in knowledge experts from the world's top doctors. So we're not just relying on AI, but we're not just reading the science, but actually what does the best doctors in the world think about how to approach this problem? And what does your data say? And be able to gather all your data. So it's not right now, it's just your lab tests, and where biosensors are going to be integrated. We now can get your electronic medical records. We'll be able to get your omics, your stool testing, your blood testing, saliva testing, your genome testing, metabolome, all of it, and imaging even. All of it will go into your personal portal. It's like your hub, your health hub. And we'll have data-driven healthcare. Right now, we don't really have data-driven healthcare. You go in to see your doctor, and even the best doctor, they only know what they know, right? They only been to the school they've been to the residency they've been to, read the articles they've read, and seen the patients they've seen, and it's a limited data set. So, would you rather have your for example, retina looked at, or your skin lesions looked at by a system that's seen billions of skin lesions, or by a dermatologist who's human, who has seen thousands, not billions, right? And so I think we're moving in an era where we're going to have AI enabled healthcare. It's not that AI is going to replace the doctor, but it's going to help us to really understand the patterns and the connections and what's going on in your body in ways that we haven't been able to before.
My dad is a cardiologist, and anytime I ask him a medical question, he goes, here and here. I'm
That's
pointing
right.
to my chest. So
Well, that's exactly right.
I'm like, I appreciate the honesty.
Oh my God. See, this is such the problem. See, I'm a systems thinker. And when I was in college, I studied systems theory and studied Gregory Bateson, who was married to Margaret Mead, who people know was sort of the an anthropologist from way back when. And Gregory Bateson was an incredible thinker, but he really talked about sort of the idea of systems thinking, and called it cybernetics, and everything is connected. So think of it like an ecosystem in a rainforest. Any thread you pull will affect everything else. And so it's absurd that we have these subspecialties that where doctors aren't trained to think about the body of the systems. For example, heart disease could be caused by a bacteria in your gut.
Wow.
Right? It could be caused by heavy metals or toxins. It could be caused by infections that drive inflammation that you might not be aware of. So, when you think about heart disease, it's not just, here's your cholesterol's high, take a statin, end of story. It's much more complex than that. And so I think we're starting to understand that disease is very different than we thought, and that the names we have for disease don't really reflect what's really going on in the root cause. So root cause medicine is what we really do. And looking at systems and understanding the connections between everything. Because, I'm interested in all your data. Like if you come in and you say your ear's itchy, well, that's a really important data point. Even if you came in because you have a rash or because your stomach's bothering you, but you also your ears itchy, well, that tells me something, right? And so I think medicine has become very, unfortunately, super specialized and non-inclusive of all your story. I want to know everything. I want to know everything. I want to know what you eat. I want to know all your habits. I want to know all your family history. I want to know what happened to you throughout your life. I want to know every possible symptom you have, even if you think it doesn't even matter, like what my eye twitches. Well, that could be a magnesium deficiency. That could explain a whole bunch of different things, because that's involved in 600 different enzymes. And 45% of people have magnesium deficiency, but nobody's checking it. Well, we check it.
Mm-hmm.
So we do a deep nutritional analysis, omega-3 fats, and we look at vitamin D and zinc. And we can also look at things like methylmalonic acid, which is a much better indicator of B12 deficiency, and homocysteine, which indicates, methylation issues that have to do with the way we regulate our gene expression and neurotransmitters and detoxification, and it affects your risk of heart disease and cancer and mental health issues. And again, these are things that are really not checked by your average doctor. We measure insulin. I mean, we working with Quest, and I said, how many doctors are ordering insulin? Like when you get all the lab tests you get with panels you get, well, he says probably less than 1%. I said, how many people are checking the most gold standard test for looking at your cholesterol, called lipoprotein fractionation? Basically, you look at the particle number and the particle size, not just the number like your cholesterol number. And that gives you a much better idea of what's going on. He said less than 1%. And this has been a test that's been around for 40 years. I've been using it personally for 30 years. for 30 years. And yet it still hasn't permeated cardiology. Some good cardiologists are using it. People are using it, but it's like, we have so much advances in science and medicine, and doctors get stuck in the way they do things, and they don't change, or they don't keep up to date. It's not their fault. They're busy. The healthcare system's overburdening them. Mm-hmm. It's very stressful to be a doctor these days. You're like a cog in a machine.
Lots of burnout.
Right? Leads to burnout. But the problem is then people aren't getting the care they need. So imagine having real time, kind of constant updating of the knowledge base, of this knowledge data set and graph that allows us to create medical intelligence that's personalized to you. It creates a predictive model of where you're at now, what's going wrong, how to fix it, with deep insights from all the scientific literature, the world's top doctors, and your own data.
Mm-hmm. It's really empowering to have all of that information. And as you're talking, I'm just curious, why is there a discrepancy between not only the types of tests that most doctors do, but the value ranges? Because it sounds like what you were saying about
ranges, you mean?
Yes, like vitamin D, standard range, they say 20, okay, you're good because you don't have rickets or whatever. But that doesn't mean it's optimal.
Well, there's a couple of problems. One is in medical school, we're trained, and every doctor's trained like this. The way you diagnose is history, and which is true. You need to take a very good medical history. And then they say, well, you only do tests to confirm your hypothesis. So if you think someone let's say someone comes in and they're thirsty, they're hungry all the time, they're peeing all the time, then those are signs of diabetes. So then, I should check their blood sugar, right? As opposed to proactively checking their blood sugar. It's like I had a patient who came in to see me and his blood sugar was like 115 or so 20, which is sort of pretty close to diabetes. And I'm like, hey, did your doctor check this and look at it? He said, well, yeah. I said, what did your doctor say? He said, when you reach, like 126, which is diabetes, then we'll give you medication.
Oh, God.
So doctors are really not good at this proactive testing. They're trained to think it's a waste of time, a waste of money. It's going to create a lot of extra work. It's going to pick up things that you're going to chase called red herrings that don't mean anything. But on balance, it's way better to have more data on yourself and learn what's going on. And so that's one reason that doctors don't do it. It's just we're told to not do it. And the other is that, idea that's really important is that you want to test, you don't want to guess. Like I've done an enormous amount of testing on my patients, and it's amazing how much you find about what's going on that you don't know. Like, for example, I had a patient who's pretty healthy. I thought he was pretty healthy today, but I looked at his labs this morning and he had a lot of free radicals and oxidative stress, and he had this deficiency of something called C15, a very important fatty acid. It's one of the kind of a new essential fatty acid.
Fatty 15,
exactly. Mm-hmm. But fatty 15 is just the brand name, but the biochemical name of it's carbon. It means carbon 15 is where the carbons are, the bonds are on the fatty acid chain. Technical doesn't really matter, but bottom line, he was very low in this. And I was like, oh, wow. So, and it's really important for aging and inflammation and longevity. So like there are things that we are missing all the time with people that we don't test. So I think it's really important. Second is why are those ranges all over the place? Well, the way we come up with lab reference ranges is based on something called a standard deviations from the mean of 2 standard deviations. So it's just a technical way of looking at statistics. So if you were a Martian and you came to America, and 75% of the population is overweight, it would be normal to be overweight. That would be consider that normal. So when we say normal, we mean something that falls within 2 standard deviations. That's what the definition of normal is. But if the whole population is skewed to being sick, then, for example, insulin is a great example. Most doctors don't test insulin. If you look at the lab reference range for insulin, it's 15. Well, if your level of insulin is 15, you're in trouble. Your level of insulin should be 5 or less. 5 to 10, you're getting into trouble. Over 10, you're in trouble. And the lab reference range is 15. Why? Because 93% of Americans are metabolically unhealthy. So when you're testing thousands of people, the bell curve is going to look a certain way. And you go, okay, well, this is where people fall, and that's average. It doesn't mean it's optimal, right?
That's a little terrifying that we're using that as our reference point for our health.
Yeah. And it keeps changing. We keep changing. Like doctors get smarter. Like we used to have, the diabetes used to be a blood sugar of 140. Now it's 126. Above 140 over 90 was considered high blood pressure. Now it's like, 130 over 80, right? So we keep changing the goalposts as we begin to we say, oh, hemoglobin A1C was fine up to 6.5. And now we're going, maybe it should be 5.5. Because we see increasing disease in a linear way with higher levels. So, for example, the A1C is something most people don't check, but it's part of our panel at Function Health. It's a measure for your average blood sugar and damaged proteins and sugars, and it's sort of like a sign that things aren't right. And when we talked to the guys at Quest, they could see starting at a level of 5. Now, 6 is considered diabetes. By some standards, it's 6.5, but 5.5 or less is considered optimal. But they found even between 5 and 5.5, if you track those people and you look at their biomarkers or other lipid biomarkers like cholesterol and everything, and their cardiac risk starts to go up with everything with a level over 5.1 or 5. So what's the optimal? Maybe it's 5. What if we were living in perfect health? What would those numbers be like? So, and that's the idea of Function Health, is to get you back to being able to understand how to optimize your health so you can live 100 healthy years. That's our goal. Live 100 healthy years. That's why you have the code Blonde Files 100.
Love it. So let's talk some of the foundational things that we can do on a daily basis in our lives and our lifestyles to reach optimal health.
The one thing that's so surprising to me is that most humans, are pretty smart, but they're really dumb about understanding a very simple fact, which is that we are a biological organism and we require certain things to function. Like if you buy $1 million racehorse, you're going to make sure you take care of it properly, exercise it properly. You're certainly not going to go feed it pizza at McDonald's and a Coke, right?
True.
We feed our dogs better than we feed our kids.
Yeah.
I mean, you wouldn't give your dog French fries, a Big Mac, and a Coke, but we feed that to our kids. It's insane.
Yeah.
And so we somehow think that we can do all these things to our body, like eat crappy, not exercise, drink a lot, not sleep enough, not manage our nervous system. We were just chatting a little bit earlier how, we're both doing a lot, we're busy, we're trying to be involved in making the world a better place by doing the work we do. But sometimes, it's like you wake up and you got stuff to do, or you get on your computer, or it's stressful, and you need to understand you're a biological organism. So you have to follow the laws of nature, and if you don't, you're screwed. Basically, you get sick, and it's not that hard. It's like, and diet. The diet is the foundation, right? Food is medicine, number one. So understand everything you're putting in your mouth is regulating every single biological function. It's affecting your microbiome. It's affecting your mental health, your immune system. It's affecting your metabolism. It's affecting your gene expression. It's affecting which peptides get produced in your body. Everything, literally everything, the structure you're made of, how your tissues are formed, everything depends on what you eat. So there's all these extreme, controversies about diet. Should you be vegan? Should you be a carnivore? It's like, and the reality is that in the middle, like in a very large swath of the middle, like maybe 2% on either end, or there's like kind of extremes, but everybody agrees we should eat real food. Everybody agrees we should eat whole foods and unprocessed foods. Everybody agrees we should not be eating so much sugar and starch. Everybody agrees that ultra-processed food are bad for us. Everybody agrees we should be eating more fruits and vegetables. Everybody agrees that nuts and seeds are good. Everybody agrees that, you need at least adequate protein. We can talk about where to get the protein from, but the science is not that questionable. Like, it's pretty darn good. Yes, there's still stuff we have to figure out, but eating real whole foods and understanding how to eat an anti-inflammatory whole food diet is just so key. The second is you got to move your body, and figure out how to do that. And whether it's just taking a walk or going to the gym or whatever turns you on, hiking, biking, tennis, yoga, do something. Strength training particularly is important as you get older. Sleep, people don't prioritize sleep, and they don't know how to do sleep hygiene. They're on their phone or computer, and then they try to go to bed and I can't sleep, or they wake up 10 times a night, or they drink. And we have to wind down at night. We weren't evolved to live in an environment where we're exposed to incredible stimulation. I mean, you can watch a horror movie at 11 o'clock at night with bright lights on, and your nervous system's
scrolling
jacked
on
up.
TikTok.
Oh yeah, I don't even know what TikTok is. I kind of avoided it. I know it is, but I mean, I just am this is
that's a luxury.
So we need to sort of practice good sleep hygiene. Dark room, cool temperature. Don't eat 3 hours before bed. Wind down at night, take a hot bath with Epsom salt, just simple practices that you can build into your life. And then learning how to regulate your nervous system. I know most people don't know how to do that. And breath is incredibly effective. And we always have that. Just take a deep breath. It's like, it's your diaphragm will actually activate the vagus nerve, which is the nerve that resets your stress response. And so just by taking 5 deep breaths into the count of 5, out to the count of 5 times, you'll be a different person 5 breaths later, and if you want to do more stuff like yoga or meditation or, breath work, I mean, all that's fine. There's all kinds of apps, Headspace. I like Newcom. It uses binaural beats. And there's a lot of ways to reset your nervous system. So you have to get all those basics. And then once you've got those basics of food, exercise, sleep, stress management, and you learn how to make them automatic and build them into your life, right? Because you can't, if your life isn't set up for it, you're not going to do it. So, make sure you have what you need around you. Like in your morning, if you want to have your morning smoothie, make sure all this stuff is out and easy to get. If you want to work out, make sure you have a pair of running shoes, or, take a walk in, just learn simple things. And I've written a lot about this in my books and blogs and so forth. And then the vitamins and supplements, I think, are really important because we live in a very nutritionally depleted world. And I wish we didn't, but I can tell you after doing, probably 20,000 patients' lab tests and nutritional levels that most of us have some problem. I mean, and this is not my opinion. This is the National Health and Nutrition Examination Survey, a large government survey that's an ongoing research database that tracks Americans over time and measures their blood work. And they're like, 90% of Americans are deficient in one or more nutrients at the minimum level to prevent deficiency disease. So how much vitamin C do you need to not get scurvy or vitamin D to not get rickets? That's what they're talking about, not levels that are optimal. So it's probably like all of us need a multivitamin, fish oil, vitamin D, magnesium, maybe a probiotic. I mean, that usually covers the basis. And then you can get into all kinds of other fancy stuff. But if you just do that, like you're 80-90% of the way there.
Yeah, I mean, a lot of these things really are so simple, but I think what happens for a lot of people is that they get overwhelmed because there's so many different areas, right? There's sleep, there's exercise, there's diet, there's stress management, and it feels kind of insurmountable. And especially when people are busy, it feels like there isn't enough time in the day. And I get this all the time. I started doing TM in 2018, which is 20 minutes twice a day, meditation and silence, changed my life. Yeah. And everybody is like 20 minutes twice a day. How do you find the time? But I do this too sometimes.
How many hours people spend a week trying to figure out what they're going to watch on a streaming service
exactly.
like Netflix?
Every time I sit down to watch TV, which is rare, I spend an hour scrolling trying to find something to watch, and then I don't find anything, I turn it off.
Yeah, we waste a lot of time. I mean, if you actually did a time audit of your life and a money audit, people are surprised. Like, I don't have money for this, I have money for that. Well, look at what you spend your money on. Maybe you're, getting that coffee at Starbucks every day for $5. And well, that adds up to more than $1,000 a year, right? So, maybe there's a few things like that if you care about your health, that you can start to shift your priorities and invest in yourself a little bit.
Where do you think is the easiest place to start? Do you think it's food? If somebody is listening and they're going, I don't do any of this. I'm up at whatever time they wake up, they get on their phone, they're on their phone till the end of the night. There's no diet, there's no exercise.
What I found is in my practice, how powerful food is to change people quickly. And people can make incremental changes. Like if they're drinking, 12 Diet Cokes, they could go to 6. Okay. Or if they're eating, like cereal for breakfast and they switch to eggs. Okay. But the real issue is how do you get people to understand the connection between what they're doing and how they feel? And I wrote a book about 10 years ago called The 10-Day Detox Diet. And essentially it's out of the work of seeing patients, and that the most anti-inflammatory healing diet that can be done in a short time to shift people's well-being. And I've done this with thousands of people. And it's remarkable, in 10 days of just changing your diet to whole foods, getting rid of processed food, practicing a few simple habits, the average reduction in symptoms from all diseases, and we're talking about everything from sinus and allergies to irritable bowel, to migraines, to depression, to joint pain, to acne, to whatever, you name it, whatever the problem is, wherever it is in the body, in 10 days, there's a 70% reduction in all symptoms from all diseases. Like if there was a drug that could do that, it would be like a way bigger than Ozempic. Okay. but in 10 days, people can actually see the connection between what they eat and how they feel. And the diet is very simple. It's just protein, veggies, nuts, seeds, berries. Get rid of all processed food. Get rid of sugar. Get rid of flour. Get rid of grains and beans for a short while, because sometimes people have trouble with those. Get rid of dairy. Get rid of gluten. Just get yourself on a diet that's going to be incredibly healing, and it's delicious. It's not deprivation. It's not calorie restricted. And I'm actually launching a 10-day detox online program course where people can join. But it's such a profound experience for me, because when I see people, we have them do these questionnaires which score their symptoms before and after, and the way people feel, it's just tremendous. So I think as a place to start, you can do anything for 10 days. And you encourage people to think about doing that, because if you do that, then you'll see, oh, geez, I don't have to have these migraines or this joint pain, or my nose doesn't have to be congested and I have this post-nasal drip all the time, or I don't have to be like tired, and I don't, like, your body will change so fast. And then you can see just the role of food in how you feel. Then you can make a choice. Say, well, look, I know that if I eat dairy, I will get congested and a runny nose, and I might get pimples. Mm-hmm. I know that because I've done this experiment. But sometimes I'm like, I love pistachio and hazelnut gelato, so I'm going to eat it, and I will suffer the consequences. But at least I know.
Yeah.
And then I know if I stop, it'll go away.
Yeah.
But we have to learn our bodies. So I think just starting with food is really important for people.
Yeah. And I think feeling good is the best motivation. Really, once you get a little taste of that too, then you want to continue that, and healthy habits beget healthy habits.
Exactly. I mean, the first few days for the 10-day detox can be challenging, because people are actually getting into withdrawal symptoms, and they have lots of inflammation in their body, and they have all these immune complexes that can make them feel like they have the flu. And it's a physiological thing when your body gets off the crap because it's used to it, but it's creating this low-grade chronic inflammation in the body. You get rid of that, and people are like, wow, I feel so amazing. And it's like, we don't have that, opportunity to really make the connection between what we eat and how we feel. Mm-hmm. Even the smartest people, I'm like, have no clue.
You mentioned earlier protein sources. So I know that there's a lot of confusion around that as well right now. So what are the best protein sources? What should people be looking for when they're incorporating that into their diet?
I read a number of books, Food, What the Heck Should I Eat? And the Pegan Diet is a shorter kind of version, which is sort of like a how-to, which kind of summarizes science. And I've written a lot about this. And there are 4 issues really around meat and veganism. One is health. One is environmental, and climate, and the other is moral. That's 3 issues, not 4. And the moral issue, if you're a Buddhist and you don't want to kill anything, I get it. And that's your value system. You just have to know how to manage your nutrition. For example, I was a doctor for this abbot of Menri, who basically was from the Tibetan tradition called the Bon tradition, and he was the Dalai Lama's meditation teacher. This guy was 87, whatever. He had type 2 diabetes, and I'm like, and he was a vegan, and I was like, you're really causing yourself a lot of trouble with the way you're eating, and because you're eating a lot of flour, and they had the traditional sampa, which is their breakfast with barley flour. And I showed him what he was doing, and we checked his blood. I convinced him there's an issue, and we just got him eating more nuts and seeds and more beans and exercising more and getting all the other starch out of diet, more veggies. And he lost 30 pounds. His diabetes reversed. He felt great. And so, if you're vegan, you can do it, but it's harder. I think the environmental climate issue, the regenerative agriculture movement is really important. I'm working really hard in that area to try to change how we farm, but conventionally raised animals is a crime. It's a crime for the animals. It's a crime for the environment. It's a crime for climate. It's a crime, against us, because we're eating all this stuff that's really poor quality. It's affecting our health. But regeneratively raised animals are actually very healthy for you. And if you look at the data on meat, people can point to this or that study. When you look at the totality of the evidence, really there's no evidence that unprocessed meat is bad for you. And that, in fact, the opposite. If you get older, the amount of protein you need gets more because you develop muscle loss, and you also have something called anabolic resistance where you can't actually build muscle. And so people need way more protein than they think. So you need about a gram per pound. Now, if you're a vegan, the only way to get that much protein is because, if, for example, if you have four ounces of chicken or meat, that's like 2 cups of beans or 6 cups of rice. No one's going to be eating 4 cups of beans or 2 cups of beans or 6 cups of rice at a meal. So you have to supplement with processed protein powders, like pea protein or soy protein, and you have to supplement with additional amino acids because they don't have the kind of amino acids that build muscle. So you can do it, but you have to eat a lot of processed food to do it, which I'm not a big fan of.
It sounds like processed food is probably one of the biggest offenders that we encounter in our day-to-day lives.
Sure.
And it's something that we're exposing ourselves to
Ultra-processed food.
3 times, potentially more daily. What are some of the other biggest offenders to our health? You know, it sounds like we've been talking about stress, things like environmental toxins, toxins in our skincare products, our cookware. What are some of those major things that we could be cognizant of?
I mean, I would say the 3 things that are probably, let's just sort of assume exercise and sleep and stress management are all really important. The 3 biggest drivers of disease are ultra processed food and sugar and starch. That's one. The second would be changes in our microbiome that are related to the dietary factors as well. And the third is toxins, environmental toxins. And those are things that we are exposed to. We live in a sea of toxins. I just had my blood work checked, and I'm like, been for 30 years, been trying to, detox and eat healthy and not have crap. But I go out, I eat at restaurants. I'm not like living in a bubble. So I'm not like on a farm in Hawaii where I'm growing my own food and drinking my own water that comes from like a spring, Like,
sounds nice.
I mean, that's great. But my body was full of toxins, formaldehyde, phthalates, pesticides. I mean, BPA, because I touch credit card receipts. I have to, because I'm, for business reasons, I have to sign the credit card receipt and keep it. And it's full of bisphenol A. And these are serious toxins. Heavy metals, mercury, antimony, aluminum. I'm very careful. I don't use aluminum deodorant. I don't drink, I don't have, aluminum, the things that you can get from, for example, like if you have heartburn, there's aluminum in some of the antacids. But I don't do any of that. And yet my body was just loaded up. And I did a process to clear it out. But, we're all toxic. And so reducing your exposure is really important. That's why I'm on the board of the Environmental Working Group, which is, or EWG.org, where they really guide you on how to reduce your exposure. So how do you do that? Well, filter your water. So I have a reverse osmosis filter in my house. An air filter, a purifier, can be really helpful depending on where you live. Making sure all your food is as clean as it can be. So they have a dirty dozen list, which is the worst contaminated fruits and vegetables, and a clean 15, the least contaminated, to help you choose what to pick. They tell you how to choose the right, animal foods, and which fish are the least toxic, and which household cleaning products are the least toxic, which skincare products are better for you, because you can use their app Skin Deep, and you can see, oh, this is my makeup, or this is my skin cream, or this is my whatever, and it'll tell you. But what I would say is if you aren't going to be able to eat it, you shouldn't put it on your skin, right? Because everything goes through your skin. Like, when someone comes into the emergency room and they're having a heart attack, the first thing we do before we even get an IV in is we take a toothpaste tube full of nitroglycerin and we squirt it on their chest and put a bandage over it so it goes right through the skin.
Wow.
Because it works really fast. We know an estrogen patch, right?
Right.
We know there's a lot of medication.
Progesterone cream.
There's fentanyl patches, right?
Yeah.
There's like all this stuff goes through your skin. Mm-hmm. So whatever you're putting on, whether it's sunblock or makeup or skincare products, they're full of crap. And so there's a lot of ways you can reduce your exposures.
And I think there's a lot of cognitive dissonance too.
Yeah, and microplastics. I mean, like I love that you're drinking out of a glass bottle because we can now measure microplastics in people, and there's microplastics in the plaque in the arteries and men's penises and all kinds of crazy places. Yeah, so
crazy.
Yeah, so you want to reduce your exposures for sure. And by the way, we test toxins. I mean, I'm amazed at the function health test how many people are mercury poisoned because people like sushi, and people don't think twice about eating tuna, and it's delicious. I love tuna, but it is so high in mercury.
Mm-hmm.
People are actually poisoned and they don't even know it. And what happens is they don't know because they feel fine. And then it just accumulates until something happens and they get autoimmunity or they get chronic fatigue or they get heart attack or something.
Yeah. Does everybody have a different threshold? And, certain people can keep exposing themselves to those things and nothing really happens while others get really derailed.
Yeah, for sure.
That?
Like it depends on your genetics. For example, I have really crappy genetics when it comes to detoxification. So when I was in China, I just accumulated a ton of mercury. I remember I had a 7-year-old patient who loved to eat sushi, and he had a mouthful of fillings, and he didn't have any. When we checked his system, he cleared it all out. So the people are different, for sure. But a lot of us are just walking around toxic waste dumps. I mean, if we were food, we wouldn't be safe to eat.
That's a big takeaway. Mm-hmm. Well, I think there are so many practical tips that people can take from this episode, easy things to incorporate into their lives and maybe cut out, and also a really actionable thing that they can do, which is, get all of this testing done. And to your point, become the CEO of their own health. So I think what you're doing is amazing.
Thank you. Yeah. I mean, to me, this is really the future of healthcare. Is, we're disrupting the whole healthcare system by creating a data-driven model that you own, where you're in charge, where you have access to your data, where you can use medical intelligence, this kind of concept that came up with to really help you provide insights into what's going on in your trajectory of your health and to intervene early, or even, if things are fairly progressed, you can then get on them. Like my friend who's 35, who had this, blocked arteries, and he's 35 years old, like he's got to get on this stuff. So I think, we have this incredible moment now where we're democratizing healthcare, we're decentralizing healthcare, we're providing access for people, we're putting knowledge in people's hands, and getting out of this paternalistic system where the doctors and the healthcare system and the insurance companies are this firewall that you have to fight through to get what you need and what you want, and then you don't even get it because they don't know what to do with it. They're not thinking about health, they're thinking about disease. So, we don't really have a healthcare system; we have a disease care system. And we don't really have health insurance. We have disease insurance. So I think of Function Health as true health insurance. Mm-hmm. So for $4.99 a year, it's pretty cheap.
Mm-hmm. Well, tell everybody where they can find you and where they can sign up.
Well, they can go to functionhealth.com and they can use the code BlondeFiles100 to skip the wait list of almost 300,000 people and get your labs done. It's a very easy process, 5-minute sign up. You go to the lab near you, Quest Lab, it's 15 minutes in and out. To check out my work, you can check out my podcast, Doctor's Pharmacy. I have another one called Health Hacks. And also I've written, 20 books, and you can check my website, drhyman.com. And also social media is just Dr. Mark Hyman.
Thank you so much.